Good evening, everyone. It's good morning, good afternoon, good night, but I'm here talking from different parts of the world. I'm Dr. Divya Sudarshan. I'm a gynecologist and an obstetrician. I'm a laparoscopic surgeon and a sexologist. So the first question would be, what am I doing here? Because definitely you know the medicine, but where is the art? And if art is beauty, this is usually where I see beauty. In the large fibroids, in babies. And the next question is this art? I've been asking myself the same thing too. If it hadn't been for Dr. Kunle and my cousin who dragged me into this, I'd probably be very, very worried because almost everyone in this group is so accomplished. They're an educator, a curator, a navigator, mentor, facilitator, and I feel like an imposter out here. So let me talk about my journey towards creativity. It all started as usual, right at the beginning, where I painted any surface that I had that allowed it. And then after that, started looking for some weird things to paint, which I would. And then sometimes the art worked and sometimes it didn't work. And from there, once the walls in my house were already full, I started painting my friends, started painting for my relatives, my nieces, and it just went on. That's when you realize, like good old Sherlock Holmes said, that the frailty of genius is that it needs an audience. So even if you're not a genius, if you're an artist, you definitely want people to see it. And that's what I realized when I spoke to my friends and my patients and everything else. So fortunately for me, I had a small space that was available. And so I decided I'm going to start a small little gallery, and I called it Belly Stories, because Belly Stories is basically the fact that every belly has a story to tell. And I made it free for everyone. I made sure that people could keep their paintings, whatever artwork they did, and it was all for fun. And it lasted. It was great fun while it lasted, but my practice picked up. And usually, as things happen, when two things happen, if the smaller one loses out. So my Belly Stories was a casualty. But one thing I did learn is that art is always from your own perspective. The people who kept stuff kept it thoroughly enjoying whatever they did. And they just loved the fact that it was there for exhibition. And so Belly Stories was yesterday, and I moved on. My tryst with art continued. I just couldn't stop doing whatever I did. And therefore, this is my clinic wall, because I didn't like a drab blue wall while I was seeing patients. So I decided I'm going to paint it, and God knows what I did. I started adding color to corridors. So every hospital that I went to, I started adding color because I just wanted it to be so much better. Patients can get extremely depressed and dull and, sad when they're in hospitals, and they need to see things bright. So these are waiting areas in the hospital. This is my outpatient clinic in the hospital, and just a couple of paintings that I did. And then COVID happened. So I realized that art should be silly too. It's not just serious all the time. You don't have to take yourself, it doesn't always have to be. So I used to wear these funny little masks, and you can see my happy doctor mask, because people couldn't see our smiles. And most of the time, what happened in these cases was that we had, to paint on the mask so that they could see my smile, and that was about it. So that was COVID. And then after that, I started thinking about art for our medical community, because, the nurses went through hell too. The nurses had a tough time. The nurses were doing long hours, and we decided that we need to make something fun. And in India, these kind of paintings that are done on the floor, what we call floor art, if you please, are called rangolis, and they're called columns in the south. And basically, they're a way of decorating your threshold in your house. It's wonderful for a celebration or a festival. We do it normally. We do it for weddings, and we believe that it adds prosperity and luck and everything else to the house. So this was something that is culturally alive for us, and this is something that we started doing, because art should be inclusive. People should enjoy what they're doing, and they should know what they're doing. And so you can see our nurses out here dressed up. The one on the right at the bottom, if I were to enlarge this, would be the right hand bottom is made of flowers, and that is called poo column. And then we started, the one thing I realized when we started doing this was, in this endeavor of, working with our nurses, the relationship changed. We weren't just doctors and nurses. When we were painting, it was more friends, we were more colleagues, and we were, it kind of opened up new doors and new doors of communication for us. And we thoroughly enjoyed it. So again, as the global arts and medicine question, what are my long-term plans? Well, I think Calvin could say it better than me, because it's basically incomprehensible, is what I would think. But still, I have some pipe dreams. One is to decorate every blank hospital wall that I can, because there's too much of glass, too many drab tube lights, too much of cement, and too much of sadness. We need a little bit of color and fun. I also believe that we have to look at a fun approach to medical support groups, because PCOS and obesity and all that seem to be all about losing weight and medicine and everything else. Nobody talks about it, keeping the weight or the other things out of it, because fun is an important factor. You have to look beyond the disease, and I see that people in Africa are doing this, and I think I would love to start something like this out here, even a stand-up comedy for that matter, because I think comedy is art too. So now, the last question, let me turn your question on its head, that what about art and medicine? Let's talk about, why is medicine an art? It requires patience and patience. It sees what is and visualizes what can be. It makes the ugly beautiful. It spreads joy. And there's never any wrong approach in medicine, because anything that you do, if the results are good, is worth it. So, like art, all's well that ends well. And that's all I have to say. I hope to learn a lot from this community. So thank you so very much for giving me the opportunity.
What you got in store?